I hope you enjoyed that short break, and I'd like to thank our generous sponsors, CSL, who provided the video that was available to watch during the break. So welcome back to our afternoon session. I'm Graham Mann. I'm the Director of the John Curtin School of Medical Research at Australian National University. And it's a really great pleasure to bring you back to this session. I'd like to begin by acknowledging that wherever we are, excuse me, I'll just mute my other live stream. I'd like to begin by acknowledging that wherever we are, we're meeting on the land of First Nations people. And I'm speaking to you from the land of the Ngunnawal and Ngambri people. And I pay my respects to their elders past, present and emerging, and to any Indigenous people here present. It's my great pleasure to introduce now the chair of our third session on the impact of COVID-19 pandemic on the research sector, Professor Jim Mccluskey. Professor Mccluskey is a leader in the immunogenetics and biology of the human leukocyte antigens of the major histocompatibility complex. His discoveries have illuminated the biochemical basis for HLA selection of antigens, genetic control of cellular immunity, and the structural basis of T-cell recognition, providing a paradigm for the basis of HLA associations with human disease. He identified the mechanisms of determinant spreading in systemic autoimmunity, developed novel autoimmune diagnostics, and strongly influenced transplantation matching. He's exerted a broad range of professional and research leadership, including the development of Melbourne's Peter Doherty Institute for Infection and Immunity. And he's the Deputy Vice-Chancellor Research at the University of Melbourne. Welcome, Professor Mccluskey.
Thank you, Graham, and welcome everybody to this session where we're going to explore the impact of COVID on the research sector. Quite a big topic, but some very distinguished panelists to talk through how this has impacted at their institutions. And I'd like to start by introducing the panel today. We have Professor Sally Redman, who's the CEO of the Sachs Institute, Professor Kathryn North, Director of the Murdoch Children's Research Institute, Dr. Gina Ravenscroft, a Senior Research Fellow in the Neurogenetic Diseases Group at the Harry Perkins Institute in Perth, Associate Professor Chris Blyth, Co-Director of the Wesfarmers Centre of Vaccines and Infectious Diseases at the Telethon Kids Institute, and Professor Karen Canfell, Director of the Daffodil Centre. So, marvellous group of people, should be a fascinating conversation. And I'm going to begin by asking each of the panelists to speak for a minute or two on the broad impact of COVID on research and researchers at their institution, and just getting the overall impression of how this has landed across our sector. So could I begin with you, Kathy North? How has this landed at the Murdoch Children's Research Institute, and what type of things have you had to do to deal with it?
Well, Jim, as you know, we have a broad range of research across the Institute, and particularly impacted was our face-to-face research in terms of clinical trials, but also a lot of our population and community health studies. And we've been in the middle of rolling out a whole of state population cohort, Gen V. So our teams on the ground have faced a huge amount of disruption for the 275 days that we've been in lockdown in Melbourne, but who's counting? But what I've found is that people became very resourceful. There's the overused term pivot. We certainly focused a lot of our research on COVID, particularly out in the community and its effects on children. I think the big negatives for us, as I think for all of the research community, is our decreasing ability to engage with our international collaborators, not being able to get face-to-face for almost 2 years. And then I think the biggest thing that I've witnessed is the cumulative stress and anxiety that people have been experiencing in all different circumstances, whether it's homeschooling, whether it's living alone, whether it's care in a carer's capacity. And I think that we're coming to the end of 2021 with a sense of exhaustion. And I would say I find everyone exhausted, a bit subdued, and I'm really looking forward, fingers crossed, to 2022, when we can be bringing people back together so that we're feeling that energy of direct interaction.
Thanks, Kathy. I think that there's a lot there that resonates. Gina, probably a very different experience for you in Perth, but nonetheless isolated, and that would come with its own challenges.
Yeah, so when I was first asked to join this panel, I thought, do they really want me? Do they know we're in Perth? And we've only, I think over the 3 or 4 lockdowns, we've only done about 8 or 9 weeks total. As an early mid-career researcher, though, with 2 small kids, it was incredibly stressful, that first lockdown in April last year. I was writing NHMRC ideas grants with a 2-year-old and a 7-year-old at home. And even though we tried to do shifts, my husband and I, 2-year-olds don't understand the concept of shifts very well. So, and then trying to manage the student projects at the same time and trying to pivot their projects so that they were more bioinformatics based, so that they could actually get an honours project done, regardless of what happened with the institute and the labs being shut, was quite challenging as well. But we have been really lucky in Perth. We've also found, I think, that some of the students with us, but also with other groups, have decided to sort of put their studies on hold after 3rd year or after honours, because there's just too much uncertainty around travel opportunities and, going on to a postdoc potentially, that people are deciding to have a break from research and maybe work part-time for a year or 2 until there's a bit more clarity around what opportunities might be available for them during their studies. So we have found quite a few people have taken this as an opportunity to sit back and wait and think about what they really want to do before launching into projects.
Thanks, Gina. And Chris, you're also in Perth. Have you had the same experience? Can you walk us through how this has impacted at the Telethon Institute?
In many ways, I've had experiences that both Gina has, but also that Kathryn's had as well, as a research institute that has a large community footprint, including a remote community footprint. Clearly, this had a dramatic impact on our ability to not only undertake, but to deliver some of that research and engagement that we do in that sector. Many of those communities were closed to outsiders, and so many people really lost their connection to their research through this period of time. Our lab researchers, even though Perth has been incredibly lucky, had to pivot to try and make sure that everything was COVID ready and they could keep their experiments going with the uncertainty of the next steps. Something that's probably unique to us, but also to a number of other research institutes. When you're embedded within a hospital, clearly you're needing to make sure that you comply with what the hospital is doing, as well as what you need to do as a research institute. So clearly that independence, but also having to work within a set of rules that has been dictated from outside by health. And probably another thing, we've got a number of people who also have teaching and learning roles. So many people their research was put on hold, but also many people had to think about how to actually maintain all the teaching that people needed to do through this period of time, putting courses online, managing international students who were stuck. All of those put challenges on people who are clearly trying to manage not only their own research team, their own institution, but students more broadly.
Thanks, Chris. And I can certainly reflect the same at Melbourne University in terms of the teaching and research staff. I think it's been really challenging for them to turn around and have to put their coursework online. And then as we've opened up and shut down and opened up and shut down, and you will have all observed from outside of Victoria the yo-yo that Victorians have been under, that sort of putting face-to-face teaching back on while still doing the online is sort of almost doubling the work. And I think that's made a big impact on a lot of our researchers. But Sally, I wonder if you could reflect a little bit on how the Sachs Institute have coped.
Thanks, Jim, and thanks for the opportunity to be here. So I think for the Sachs, we do a lot of work with government, and so one of the changes that happened obviously was that government became totally fixed on what was happening with COVID. So what that meant for us was a real sort of change in our work patterns, where things that we were doing with government sort of stopped or halted, or the people we needed to talk to weren't there. And interestingly, other opportunities opened up, and some of those have been very exciting, I think, and promising for the future. But I guess for us, there was a big learning about being agile and flexible and all of those sort of things, which might be how we say pivot in Sydney, I'm not sure. So I think that, one of the things that happened to us was that we have a big cohort study of about 250,000 people. And with the ministry, they asked us to twist the way we ordinarily do a cohort study so that we could collect rapid information, so in 6-week cycles, and feed it immediately into policymaking, which is sort of really exciting, and you kind of hope that some of that might stick around in the longer term. So I think we had a few examples of having to do business in a quite different way that maybe offer some promises for the future. Like Chris, we had problems with our work with Indigenous communities, which just really hasn't been possible over the past year or so. And I also wanted to pick up a little bit on Kathryn's comment about how tired everybody is. And I think that combination, together with sort of having to do things remotely and not seeing people in person, I think we're starting to see a rise in misunderstandings. I would say people are tired, and maybe there's sort of a gathering feeling of kind of worry about your position and anxiety. And so I think over the last couple of months, we've spent a lot of time just on managing that and supporting their staff. So thanks. Yeah.
Interesting, isn't it, Sally? I mean, that sort of short fuse, crankiness that has kind of crept in for a lot of people. Yes. We need a little bit of a disclaimer there, don't we? I'm sorry about my COVID moment or something like that. But it's evident across the boards for sure. Yes. Karen, how have you managed things?
Well, Jim, I think I echo the comments of the other panelists, really. I mean, I think for us, we're a new centre in cancer control and policy. We specialise in epidemiology and public health and in evaluation of new innovations in cancer control. And we've come together as a new joint venture. We launched in March 2020, and it's a joint venture between Cancer Council and the University of Sydney. So it has been an exceptionally challenging time, I suppose, to create a new centre when we don't have a physical environment in which to call ourselves a centre, and when we're bringing teams together that haven't necessarily worked directly together in the past. I mean, I think that having said all of that, I think that in cancer control and probably in other NCD areas as well, there are our pivot, if you like, and I'd love a better word if anyone can suggest one for us today, but our pivot has very much been around informing decision-making and cancer control policy with the lens on this that actually, it's going to take 5 to 10 to 20 years to fully realise the impacts of the crisis, even in the best case, in terms of cancer control. We've got disruptions globally to screening programs. We've got early detection systems being disrupted. We've got, of course, delays and disruptions to cancer treatment services. And there are many, many missed opportunities in terms of, for example, scaling up new innovations in LMIC settings as well. So, for us, our pivot has really been, how can we best inform decision makers, and how can we actually help in mitigating the effects of the crisis? And we have a modelling and global collaborative lens on that piece. But in terms of the effects on our team, they have been profound. And I think, Kathryn, I really also liked what you said about everybody's feeling anxiety. But what I would say is that the source of that anxiety is very different for different individuals, obviously. And I think we were almost seeing a bit of a two-speed effect, I think, especially for early and mid-career researchers, where on the one hand we have particularly researchers in the basic sciences or in clinical trials with disruptions, with concerns, as Gina said, around their career prospects, difficulties of transitioning off PhDs to appointments in the absence of international travel. But in the public health space, there's huge new demands and new research agendas, new international collaborations, calls at all hours of the day, and a bit of, I think, potentially a bit of imminent burnout to manage for our research workforce. So I think that anxiety, that stress, I really relate to. I think it's going to need a multi-pronged response, though, in terms of how we address that going forward.
Thank you. I think that's a really fascinating overview. And I just wonder if I could go back to you, Kathy, and just ask a little bit about the impact on carers and particularly women, but not always just women, with home responsibilities in the middle of a pandemic when the place is shut down and you're doing homeschooling. And have there been specific accommodations of that at the Murdoch? Is there something you've done that we can learn from? Just how have you managed that?
I think we started off from the very beginning, making sure that we maintained contact, both from an institute as a whole perspective, but also on a group by group basis, making sure we were connecting frequently and connecting often, and recognizing the different stresses that people were facing. We also instituted what was called Flexi 75, which meant that we said, we know everyone's under pressure from whatever source. We only expect you to work 75% of the time, and we will continue to pay your full salaries. And then talk with your group leaders or managers if you need extra time or extra leave on top of that. That's turned out to be an incredibly expensive exercise over the past 2 years. I would calculate we've probably given an extra 8 weeks leave to people over the great extent of the great lockdowns and snap openings that we've had over the last couple of years. We've also, I think it's been mentioned, a big impact on our PhD students and early and mid-career researchers. So this year we funded a number of post-PhD scholarships, just knowing that, you can't go overseas to a postdoc, you can't move labs. And now we're planning, and as we look forward into 2022-23, we're continuing those initiatives to really make sure we're not losing the young workforce that's coming through, and giving them the opportunity to have that productivity and to find good postdocs. I think the other thing that we instituted in lockdown number 6 was what we call strategic executive deprioritization, which means if you don't have to do it, just get it off your list of things to do and leave it till this is over. Just recognizing you've got to empower people to not do stuff and to just not be trying to do too much, because that's the other thing I've seen so many people just rising above and beyond and, working around the clock, particularly in the COVID related work. And then finally, a bit of an upside is we switched all of our seminars, obviously like this, all of our meetings became Zoom meetings. And I think any institute director or senior university academic would bemoan poor attendance at seminars, particularly when you've got a prominent speaker coming in and a half full lecture theatre. But we had great attendance at the seminars, so that's been really good. And we're really going to look at going forward how we can maintain that enthusiasm.
Thanks, Kathy. I think that's really a very, very interesting set of initiatives. At the University of Melbourne, it was evident that a lot of our staff with children at home were sort of embarrassed and felt awkward when little hands and bodies would appear on the Zoom in the middle of what was a terribly, terribly important meeting. And so I said to the Vice-Chancellor, your next all-staff video, you have to just say, it's okay, we like this, it's fine, it's the new way we do things. And he did. And it made such a difference just to let people know, hey, we're doing things differently. You don't have to feel embarrassed. If you have to leave the room for urgent parenting duties, the world will continue to rotate and we'll forgive you.
Do you remember, Jim, the video that went viral of the BBC newsreader whose little kid came in? I mean, we've all lived that.
Yes.
Everyday occurrence.
I would like to explore a bit more the focus that we've each had on well-being and mental health issues and how we've coped with that. Kathryn, you referred to that as, you know, the two big opportunity costs are the sort of pause effect in the health system and screening and so forth. And that's a long-term issue for us. We won't know just what we've missed and what's happened under our nose, and we weren't paying attention because we were doing other things for a while. But the mental health and well-being, this has been a crisis in many places. Kathryn, do you want to talk about the kinds of measures you've seen or are aware of that, you know, people have taken to try and mitigate this?
Yeah, I can, I suppose, again, just talking from our centre perspective, I mean, I think, again, perhaps we've got a particular challenge in that we're bringing together teams from two different institutions with different institutional policies. And that's, I suppose, made it a bit more complicated to think about how best to respond, but also gives us opportunities to hopefully take the best of both worlds. And I really liked, again, Kathryn's articulation of the measures that she and her team have taken. I mean, I don't think we're as far along that road, but what we have emphasised is the importance of communication, direct communication with teams, with people really checking in with their direct reports. We're trying to make the best of the hybrid universe in terms of connection style events for teams, social events, as well as Zoom meetings and conferences. And we're trying to make the most of opportunities for live update and to keep the communication flowing. And I suppose to have, as far as possible, an open and transparent approach to communicating with our team about where we are, what the challenges are, and how we're all, I think, all in the same boat of coping with them. I did like what you just said, Jim, about really giving people permission to say no, to say no to that. And I'm one of the worst offenders for lining up meetings at 5 in the morning or midnight, right? But I think it's really important for me, I suppose, to remind myself that you know, it's every individual's decision about how much of that they take on, and we really want to empower, especially students and early career researchers, to really make their own judgments about how to integrate work and life, how to you know, how to integrate those opportunities with those international kind of connections that have emerged partly as a result of this crisis with their own lives and their other demands. So I think for us it's been I suppose an emphasis on culture, on empowering people to make their own choice, and in fact to say no to their team leads. Thanks.
Yeah, they're really important messages, aren't they? We talked a lot about you know, making sure that perfection wasn't the enemy of the good. But it's interesting, you know, there are so many driven people, you know, when those messages went out, you could see the demeanor stiffening. What? You know, we're not going to take perfection. And it just shows you how hard it can be to let go. Gina, I wonder if you would like to make any comments, particularly since you shared your own personal carer challenges. For many, that, you know, that stress has been very, very demanding. Has it been an experience for you, and how have you coped with supporting staff throughout this?
Yeah, so we made the decision to sort of shut the lab maybe a few days earlier than what everything actually shut down, because we could sort of see that it was coming, and we made sure everyone had what they needed at home to do what they needed to do. and we had a special Teams chat thing that everyone could join at the usual morning tea time. And if you wanted to join, you could go into that chat and someone would be there to have a, you know, just like if you were in the office, you could go and have a chat. It was just virtual. And so we did make advantage of using the technologies to stay in touch, both professionally, but also, you know, to look after each other. And, you know, it's great. On Twitter, I've seen people having, you know, virtual wine clubs and games nights and quiz nights and all sorts of things with their teams to try and keep that sort of connection going between colleagues over, you know, the many months that people have been separated. And I think, you know, working at night, in terms of conferences, I used to find it really stressful having to leave 2 small kids to go to a conference overseas or interstate. But actually, I think trying to be switched on in the middle of the night, hoping the kids don't wake up and come crying through into the dining room is actually in some ways more stressful than actually making the arrangement to go away and separate that life and work. And so I think if I had, you know, if someone gave me the choice now, I would definitely go rather than, you know, say, oh, I could just attend virtually, you know, on top of missing out on those networking opportunities and things. I think it's just really draining to be awake in the middle of the night and try and, you know, work and combine it all at the same time is really, really difficult. So I take the jet lag over the answering questions at 1 a.m. any day, I think. Yeah.
That's great. And with the jet lag comes that trolley that goes down the aisle on the aeroplane.
And you get to prepare your talk, you know, on the aeroplane without the children around. Whereas, you know, with the virtual conferences, they want them 2 weeks ahead of time. And I don't have the 12 hours on the aeroplane without the children and a gin and tonic to get my talk done. So, you know.
And if it's long haul, you can binge on Succession. Sally, Gina's raised, I think, fairly directly, actually, an issue around the workplace and home becoming the same. And I, you know, as an entree into managing the well-being and the mental health issues, could you reflect on your experience?
Yes, I think it's a really important point, and it's interesting because I would say that some of our staff have commented on how much they like that. They say something like, it's changed my life to be able to do the child drop off or the child pick up, you know, and I think that's really something to reflect on. We were actually in the process of introducing our workplace flexibility policy as COVID hit. So, you know, I'm not sure that we're ever going to be able to entirely retreat from that, and perhaps it's a good thing. I was also sort of reflecting as you spoke about, you know, the example that Kathy talked about with the guy in the UK with the children coming in. And I think we've probably all seen a lot more of our colleagues' homes and, you know, families and children and pets than we would ordinarily. And I think that's actually been a really good experience. I actually feel in many ways more closely connected to the people that I work with closely, because I've understood that, you know, they have airplanes over their house, or, you know, their partner's very supportive and bringing coffee or not, you know, and those are kind of interesting things that you don't usually get. And I thought Gina gave some really nice examples of that as well. And so, Jim, the only other thing that maybe I could add to this discussion is that we've had an experience, which I know will have been common to some of the other institutions, which is that some of our staff were seconded to help with the pandemic, and actually we still have people, got someone now in Wilcannia, someone in the Ministry of Health, and I think, you know, some of them aren't coming back, so that's a bit of a pity. But, you know, the main thing I think is that people have found that incredibly stressful as an experience. I don't know if that's been other people's experience, but I think it's given us a new appreciation for how hard some of our colleagues in government and the front line of health services work, but also just the need to particularly look after those people when they return to the Sex Institute. Some of them have been working like 14-hour days, 7 days a week for a while, and that's been an extraordinarily stressful experience, although one I think that by and large I valued.
Thank you, Sally. There are a couple of questions coming in from the audience. And I'm going to direct one of those to you, Chris. And you're working at a university and an institute, and lots of universities have lost staff and significant corporate knowledge, and great people have had to leave the institution. Another source of stress. How's that played out, you know, from your distance at the telethon, but connected as you are to UWA? And
it's been very challenging. So it's really the double whammy. You know, you've got staff who are needing to transition things to online. You've got stressed students who are stuck internationally. You've got local students who really don't get the support they need, and you've got job cuts at the same time. You know, it's really has, if we're talking about research, it means that those people in those teachers and research roles have really had to put much of their research on hold, having to manage serial crises over this period of time. Now, there is some investment in that really, you know, moving things online means they can be repurposed, but actually most of us didn't have all that content online at that time. And so that really took us most of last year to get to a position where we can use it and update it. So there are benefits, and we'll continue to use it, but it's been incredibly challenging for those in those roles.
I don't know if you're connected at all to your promotions system and confirmation system for staff, but an experience I can share and you can reflect is it's been quite an issue trying to figure out, you know, what is the stock standard COVID impact that we've all had, and how has that impacted on research performance or teaching quality as we ponder whether we should promote someone or not. And then to try and integrate on top of that this has not landed evenly across the sector. I think it's landed very, very unfairly on early career researchers, and in most cases, a lot of women have been, you know, asked to carry multiple burdens throughout this. And we've tried to finesse, you know, what if someone has been able to do nothing in the last 2 years, but held the job together, is that grounds for promotion? Have you had any dealings with that kind of issue, Chris?
Well, from a promotions perspective, many universities have put those things on hold, really just trying to manage these crises, which is problematic in itself. But to speak of the inequities, I think it really has highlighted many of those inequities, not just by sex, not just by career stage, but also by discipline. I personally have been the busiest I've ever been, and probably from a research output perspective, will do quite well from this. But clearly that's vastly different than someone who's in a very different field. That's not a fault of anyone. It's just the opportunity that presents. So yes, inequity is a major problem. And I think we need to have a hard look about how we judge the relative to opportunity costs during this time in both promotions, but also grants and all of those things that are clearly competitive, but are different. The thing that I didn't highlight in that inequity thing is clearly there's difference in states. You know, 200, I've lost counted as well. I can't remember the number, you know, 200 odd days in lockdown compared to a couple of weeks. Sorry, thank you, Kathy. Etched into the wall, are very different as far as maintaining teams and research output to what Gina and I have experienced. That's not to say it's been challenge-free in Western Australia, but very different.
Very good points, Chris. Kathy, questions come in from Warwick Anderson. Hi, Warwick. Interested to understand whether we think the changes in research practice that we've experienced at an organisational and individual level are likely to last. Which of the bits we'll keep and which of the bits we'll ditch?
Yeah, we're keeping a list of COVID silver linings because they certainly have happened. I think the first thing I came across was how rapidly you could get ethics approval if you really put your mind to it and had your ethics committee working with you. And so we went from a trial, idea inception to recruitment and rollout within 3 weeks for an international trial, just unheard of. And that, that changed our practices because parts of the ethics committee, because things were changing rapidly, became part of the research team as well, so that as things expanded, there was a really rapid response to that. And I think it does show that we can do things differently. The second area is the need to do things remotely, and whether it's in health or within research, the pivot, the rapid change to telehealth. I mean, we will continue to do telehealth, and we, for genomics or genetic studies, developed a whole swathe of tools so that you could do consent remotely and link in with families remotely. And that's made some of our studies so much easier because we've developed those platforms. And so I think that there are many things that we will keep. There is also the flexibility in the workplace and how we manage that going forward. And I think that is an interesting one, because you do need to keep your eye on the end game of what you want to do as an institution. And I must say, the thing I want most is to get the sense of community and connectivity back, so that you need people to be together. And so the way we're going to approach that is that coming back, when we can come back into a relatively normal workplace, that the default position is that you're back, but then we put that layer, build that layer of flexibility into what we're doing, so that we have various teams working together to plan that they've got in days when they're all together, but recognizing that you can work very effectively from home, but getting a balance and doing it in a planned way, rather than the convenience aspect taking over. I think we're going to really have to focus on bringing back that sense of connectivity and community.
That's a huge challenge for us at the university, because we see ourselves very much as a community of scholars, and the experience that we offer our students is one of, face-to-face interaction and the sort of chewing over of ideas and learning, and the experience of being with others and hearing the diverse perspectives. But we find the students are a bit sort of, I would say, schizophrenic about this. They all say they want to be back on campus, and then as soon as it starts raining, they decide to stay home and watch the lecture on Zoom. Human nature, I guess. But fundamentally, that's driving our position, that we want people back on campus because we think that's the essence of the educational experience. I'd like to turn now to a more forward-looking conversation about what have been the opportunities that have arisen out of the pandemic. We've learned a lot, we've been, to use yet another overused word, we've been disrupted. And we're all grown up and flexible and adaptable, and we realize that some of that disruption will stick. We've talked a little bit about some of that, but I think there are some deeper questions that we should consider as we go forwards post-pandemic, or it's not even post-pandemic, is it? Living with the pandemic as an endemic. So I'm going to turn first to you, Kathryn, if that's all right, and just ask if you've seen opportunities that you think will be here to stay, or that we can grab more assertively than we have done in a sort of crisis mode.
Sure. Well, look, I think I'll go back to the example of cancer control, that we haven't even started really to see the effects in terms of the long-term impact on chronic disease. And look, I think there's a couple of things I want to highlight. First of all, of course, this provides huge new research opportunities. We really need to get ahead of the game in terms of understanding, first of all, characterizing what disruptions have happened, what impact they're going to have on cancer outcomes, and how this will vary in high-income countries, and then in weak and fragile health systems in low and middle-income countries. What is going on, and what will the long-term effects be? And so I think there's a huge research agenda for us and for those involved in cancer control and policy. So of course that's an opportunity, if you want to put it that way, but it's back to that sense of, I suppose, responsibility, and be able to I suppose, be good global citizens and harness the tools at our disposal to try and assist, especially those in emerging economies, with the challenges that they face. You know, I think the other thing I would really like to point to here is what this has highlighted in cancer control and no doubt across health is the importance of data infrastructure, data systems for monitoring. I mean, in cancer control, we're very used to working with a very long-term agenda. We've had, I suppose, in a way, that luxury. You know, it's decades from exposure to cigarette smoke to the potentially the peak impact on lung cancer, for example. It's decades from an HPV vaccine being administered to actually having a woman avert cervical cancer and so on. So we have had that luxury, certainly in the prevention space, and even to some extent in the treatment space with cancer control. But, you know, we're used to working with systems where we have cancer registrations reported even several years behind times, and that has had a material impact on our ability to react and to pivot in terms of mitigate, even understanding what's happening in health systems, let alone mitigating against those effects. So I think, like never before, one big silver lining has really been this understanding that there needs to be that central and core infrastructure investment in timely responsive data systems for monitoring disease outcomes, and that this needs to be thought of globally. This is not just, you know, as we touched on this morning, this is not just an issue for high income countries. We need to understand the picture of health and disease in a much more nuanced way, in fact, globally. Mm-hmm.
Thanks, Karen. The pandemic exposing a gap or a need, I guess, in some ways. And Gina, you mentioned that you still have a hankering for climbing on that aeroplane and being jet lagged at the end of it, but there must be opportunities that you can see as well from this last couple of years. How do you think it might change your research world and things you might do differently?
Well, I hope that into the future conferences will perhaps have a hybrid model so that people who can't travel for whatever reason, financial reasons or caring responsibilities, can still partake, while still acknowledging that obviously attending in person is, the best really to make the most of the science, but also the networking and other opportunities that come from it. Also, with some of the societies going virtual has meant that people from low and middle income countries have attended conferences that they would never have attended before. And so if there's a way that, the World Muscle Society that I'm a part of, if they could keep that option available so that people from countries in Africa and the Middle East and other parts of the world that have never participated in a conference before can still participate and learn from, the latest researchers and the best clinicians about how to manage these conditions. And I think that's a real bonus as well. So I think that's sort of one of the silver linings that have come out of this. Also, our acceptance now of being more flexible around childcare and caring responsibilities and all sorts of other things that people have going on in their lives and fitting in the work around other aspects of people's lives. I hope that stays, as acceptable into the future as it has been during the pandemic. Yeah.
That's really thoughtful. Thank you. Can I go to you, Sally, and just ask more or less the same question? I'm very keen to know, what's changed forever and what might change on an as-needs basis.
Yes, thanks, Jim. And look, one of the things that's really struck me during the pandemic is the rhetoric from government, which has been about we rely on the health advice and the evidence says this, and you kind of, it's in government, but it's in the community too. Suddenly you're chatting to your sort of butcher about, what's the R factor or something, like this is sort of, as I think that whole kind of dialogue about the way we use evidence and, I think as a community we've had to adjust not just to the fact that we're using evidence a lot more, but also that evidence is changing and evolving. And, it's been interesting to hear, the way that the public dialogue has framed itself around that. And I'm sort of hearing, ministers and people say things like, well, yes, I did say that 3 weeks ago, but since then there's been a new study and now it's this, and I think that's been a really important learning, and is, I'm kind of very interested in the way that research and policy interact. So I hope that's something that we can build on for the future and find some ways of kind of strengthening that sort of dialogue, building on what's happened over the last bit. A second thing I think is that in New South Wales, at any rate, I think what I've seen is that government's made a lot of use of resources that it's had partnerships with for a long time. So the classic, probably most important one has been the National Centre for Immunisation Research and Surveillance, where the partnerships and the relationships were already very well established, and so it was easy for government to go and say that what we really need is what's happening in schools, and I think that seeing the kind of the interaction around that and the way that the research was framed, I hope that that's something that we could try and sort of hold on to into the future. I mean, we have some particular things that we're kind of keen to exploit, but I think more generally, that kind of intersection will be interesting to see whether or not we can preserve some of that.
Yeah. Chris, I'd like again to hear your reflections on this. Particularly interested in that question of the prominence of science in the public debate. And you're co-director of a vaccines and infectious diseases group within the Telethon Centre or Institute. Do you think we've conducted this debate, in a mature way as a nation? And we hear a lot about anti-vaxxers, and an awful lot of that is probably sort of legitimate vaccine hesitancy within two standard deviations of rational thinking. How do you think about it? How do you think science and the public dialogue might change going forwards?
Oh, Jim, there's a lot in that question. I do think as a community and as a scientific profession, we need to learn, and I put myself very much in that, how to communicate uncertainty better. In times of crisis, we've all seen the desire of politicians to make things black and white, and we all know around this table that there's been many shades of grey over this period of time. So I do think we need to not only invest in our own training in communication, in communicating uncertainty, but actually train our next generation of scientists to do that better than we may have done. Clearly, there's some people who've done it exceptionally well, and there's some other people who maybe not have done it as well. So I think there is something in that. I was going to pick up on Sally's comments. I think there's a wonderful opportunity. The fact that Sally's talking to her butcher about mRNA is truly incredible. The fact that these words are now on everyone's lips highlights to me that actually never before has science been more relevant, has research been on everyone's lips. And not only is Sally's butcher, but importantly, we've got a whole generation of young people who've had that seed planted, that actually research drives public policy, research drives what we do, and actually really interesting people get into research.
That's really very good. Kathy, I'm going to pose a tough questions for you, and that is, what is the role of the Australian Academy of Health and Medical Sciences in a crisis like this? And I'm just going to unpack a little bit of some of the things that I've observed, and you might be able to comment on. One has been, we've some very powerful figures have emerged, almost celebrities, in the public commentary space from within the academy and in their own right. And then I think there have been, perhaps one or two ambulance chases here and there, very keen to get in front of the camera, but not a lot of terribly new stuff to say. I'm being very tough here. I'm polarizing it to get a good answer from you, Kathy. But it strikes me there is some sort of role for the academy that I'd like to try and understand a bit better. It's got to be sort of right and wrong at the same time, that disease modelling community are almost in a contest with each other. And is that healthy, or is it not healthy, or is it both? Over to you, Kathy.
Thanks for that, Jim. I think the Academy has a great role and has actually demonstrated real leadership during the pandemic. I think the fact that we have an amazing community of very diverse experts across many different fields that we can call on and bring together. And certainly there's been the rapid response in terms of providing evidence that both the chief scientists put together, but government has also called upon. And the Academy has done many evidence-based policy briefs. And I love Sally's comment about, you know, evidence is driving activity. And that's one thing I really hope remains going forward with the really good relationships I now think that health and medical researchers have with government. I think that the other thing is when there are, you know, the modelling, the different views around modelling, and the Academy responded to that by pulling together a forum of all the major modellers and getting them all talking to each other, so that there is much more of a community of exchange of ideas, and also I think quite an open debate around why some models might differ from others. And that bringing together all of the different experts, I think, is a second great role that the Academy has. I think in an ongoing way, where we are going to see then the pointy end of the non-COVID effects of this pandemic, as Kathryn has pointed out, you know, around lapses in surveillance, increases in cancer, the mental health effects and the socioeconomic effects of the pandemic. And so again, the Academy needs to pivot its expertise in terms of how we can be, as a group, a voice of reason that is continuing to drive evidence-based policy. I think overall, this has been one of those positive opportunities or COVID silver lining, is that the Academy has really come into its own in, you know, and all of our eminent membership, some of whom have really been right at the forefront of a lot that we've done during the pandemic.
Yeah. And in terms of, I'm not sure I've given you a chance to talk about the opportunities that the pandemic has surfaced. And,
yeah.
you know,
Well, again, I'll first hark back to Sally, and just this wonderful of having the politicians say, you know, we're waiting on the evidence, or the evidence has changed. For me, in my personal interest in genomics, to have all of the politicians standing there going, so we're waiting on the genomics result. I mean, the general public isn't going to recognise that that's viral versus human, but to actually get some of these terms out into the general community, it's been a fantastic step forward from a public engagement perspective. I think just as we've had more rapid ethics and better engagement in getting studies done quickly, I think there's also been a big drive and a big recognition of the value of data sharing. That, you know, Kathryn has mentioned the needs that we've had of making sure that we have data sets readily available and that we're sharing them readily, I think is incredibly important. And then to hark back to what Gina said around the values of remote. We all want to get in a room and actually around a dinner table with our colleagues overseas and locally. But we also now have this platform where we're so used to getting together now on Zoom, it doesn't seem like a second-class option anymore. It is a really good alternative, and I think it's actually going to promote our communication in between our face-to-face conferences.
yeah, I think that is really interesting, isn't it? I mean, my lab meetings sort of default to Zoom now. We don't even ask the question, and I'm not sure if that's going to work in the long term, but I'm sure that we'll always have somebody Zooming in. And that hybrid model that was mentioned earlier is very likely to be the model that prevails. Well, colleagues, we've used our time, and I'm going to hand back to Graham in a moment, but can I just thank you, Chris Blyth, Karen Canfell, Gina Ravenscroft, Sally Redman, and Kathy North. Thank you so much for a really lively and informative conversation. Graham, over to you.
Thanks very much, Anne. Yes, that was really fantastic, and certainly resonated with the experiences that I've had and with my colleagues here at ANU. Thank you very much, everyone, the whole panel.